Hey everyone, welcome back to another video. In today's video, I'm going to talk about the pros and cons of specialized nursing. So before I begin, please consider subscribing to my YouTube channel. I'll be uploading a video every single week. Alright, so the first pro that I'm going to talk about for specialized nursing is that you become specialized. So what does that mean? You acquire more skills than a regular registered nurse. Now that has implications, so you definitely have a lot more responsibility and you do a lot more. And that is really good because you get more autonomy on your practice. So what you make more decisions for the patient, you're able to do a lot more skills individually, and because you have further training, you're able to understand what the patient's condition is and what the status of that patient currently is. Alright, so the next pro I'm going to talk about is that you simply just get paid more. Because you've done more training and you've acquired those specialized skills to make more decisions, to become more autonomous, you're obviously going to get paid more. And this ranges from a lot to a little depending on where you live and what specialty you choose. The next pro I'm going to talk about is the job market. So obviously if you're specialized, you're a little bit higher than a normal registered nurse. So that means that you become more available for different jobs. So there's a lot more jobs for you to apply for. And on top of that, you can also apply for the normal registered nursing jobs. So for example, your medicine floor or like your post-surgery, post-op floor, different floors like that. You also have job opportunities there, as well as your specialized floor that you've done specialized training. So overall, you get more hiring opportunities. The last pro I'm going to talk about is the fact that you're able to apply and be accepted to graduate programs much more easily. So because you're specialized, you have a lot more knowledge about the patient's status, you're able to understand the patient's needs, and ultimately this looks better on your application for graduate schools. So for example, if you want to be an advanced practice nurse specialized in acute care, having your critical care training obviously will make you look better. That being said, the same thing goes for example, if you want to work in labor and delivery, or you want to be a nurse practitioner specialized in women's health, working as a maternity nurse and then doing the specialty training for labor and delivery gives you that extra understanding and knowledge that makes your application stand out when applying for graduate. Alright, so the first con I'm going to talk about is the fact that you definitely work harder than a regular nurse on a med-surg or medicine or post-op floor. Because of that autonomy and because of that extra skills, you definitely have to make more decisions, and you're supposed to critically think a lot more. That puts a lot of stress on you, and ultimately that makes you work a lot harder because you're not only having to help the patient, but you're also supposed to think, is this the right thing I'm supposed to be doing? It's a lot more in depth. I know a lot of nurses do that on an acute medicine floor or a cardiac floor, but you'll be doing a lot more of that on a specialty nursing floor, which ultimately means you just simply work harder. So unfortunately for specialty nursing, you get a lot more responsibility, you work harder like I just mentioned, but the pay raise for becoming a specialty nurse is not that high. You don't make that much more over a regular nurse. So I know a lot of senior nurses that work in a medicine floor or post-surgical floor. They often tell me, you don't specialize. It's not really worth it. You get all this responsibility, you get all this stress, only for a couple $100 a month more. They don't think it's worth it, and I can see that. Alright, so the last con I have for specialty nursing is the fact that you have to specialize. So what that means is you often have to take extra courses, and these courses cost a lot of money. Thankfully, in my province, in my school, in my hospital, I should say, they sponsor you if your application is good enough, if you showed a lot of hard work. They sponsor you and pay for your specialty training courses, for example, critical care, labor and delivery, nephrology, in the operating room. and that's really beneficial. But I know that a lot of hospitals don't do that, and a lot of people have to do a lot of extra coursework in order for them to be specialized, and that just simply costs a lot of money. So there's definitely a financial burden of becoming a specialty nurse that we definitely have to consider. Alright, so those are some pros and cons for specialty nursing. I hope you liked this video. If you liked it, please leave a comment down below. What do you think? What are some pros and cons that I didn't think of? If you liked this video, please also give it a thumbs up. I would appreciate that, and I'll catch you guys in the next video.